Hey everybody, Dr. Michael Nusbaum here.
Dr. Daria, Klachko, Totten.
And welcome to
HealthTalks.
So what are we talking about today?
Well, we're going to talk a little bit about when your doctor's office calls you and they tell you your pap smear was abnormal.
Scary call.
It can be a scary call. And as we know, a pap smear is a screening test for precancer or cancerous conditions of the cervix. So we got to keep in mind that a screening test can sometimes be wrong.
Right.
So what happens if your pap smear comes back abnormal? Well, there's options.
Okay.
And it depends on what's the abnormality. It depends on the HPV screening. But generally, you might need to come for a pap sooner, like a 3 to 6 month follow-up.
Okay.
And sometimes it's when there are some mild abnormalities, they just kind of want to follow up, just let's watch with a little time to see, if there's any other changes. Right. So those paps can be followed up every 3 to 6 months. If there is doctors a little bit more concerned, saying that maybe there's some changes in the cervix that they want to take a better look at,
okay,
you might be called in for a colposcopy.
Is that the same as a conization or is that different?
Oh, it's very different.
Oh, okay.
Michael.
Okay. All right. That's why you're here. Teach me.
It's been many years taking care of it. So a colposcopy is when the doctor wants to take a closer look at your cervix. So the cells look a little abnormal in the pap. This is the more definitive test to look at the cervix. So again, I'll take you through what happens when you have to have a colposcopy.
Okay.
So you'll be asked to undress from the waist down. You're going to get on the, on the examination table, and of course, moving your bottom down, never far enough down for the gynecologist. It's more scooching, and then go. The doctor's going to use the speculum to open up the vagina to get a better look at the cervix.
Okay.
Then using a soft swab, remove some debris, clean off the cervix, and then taking a solution, usually vinegar.
Okay.
So don't be alarmed if you start to smell vinegar in the exam room. That's used to put on the cervix to kind of highlight if there's any abnormal cells.
Interesting.
Then the colposcope, which is an instrument that's like kind of a microscope, will be placed, and the doctor's going to look and study your cervix. If there's areas that they want to check out more, they're going to use a little instrument to take a slight piece of the cervix.
So biopsy
of the tissue, trying to use more gentler terms.
Okay.
Taking a little punch biopsy of the cervix. And there might be multiple areas that might need to be biopsied.
All right, quick question. I don't have a cervix, but I can imagine it would be a very sensitive area. Do you numb that?
You really don't numb that. You don't numb it because it's very quick, and the pain is more like a little cramping.
Okay.
So it's generally not horrible. I'm not going to say it's not uncomfortable because it's the whole thing's kind of rather uncomfortable, but it's fast. The whole procedure usually lasts 10 to 20 minutes from start to finish, and the biopsies are really super quick.
Gotcha.
Okay. So those biopsies are done generally on the outside of the cervix. And then taking a brush and and this causes a little bit more of the cramping, is taking some of the lining of the inside of the cervical canal.
Okay.
Once the doc is finished, all that tissue gets sent to the pathologist. And now they don't have just the cells from the scraping of the pap, but they actually have tissue to look at to see, is there an abnormality or not?
Okay.
So afterwards, what to expect. You might have some bleeding. This bleeding is generally light, it's generally not heavy. You might have some blackish discharge, and that's because the doctor might use some solutions to stop the bleeding. Okay. And that kind of comes out as black. So don't worry if there's some discharge and some blackish, debris coming out. And that should last, sometimes it lasts about a week, but it should not, again, be heavy, and it shouldn't keep going after about a week or two. If you have very, very heavy bleeding, if you continue to have pain, you might have some cramping after the pap, the colposcopy. You could ask your doctor if you could take some Motrin or Tylenol, whatever, to stop that cramping. But it shouldn't be horrible. So horrible pain, fevers, heavy bleeding, be sure to call your doctor to let them know.
Okay. Is there a risk of infection?
So this is a very low risk procedure, but it's very important to talk about risks. It is a very low risk procedure, but there are risks of infection and heavy bleeding. Sometimes there's a vessel that's not expected to bleed that heavy in the site of the tissue sampling. So those are generally the risks of it, but very, very low risk overall.
Okay.
And then afterwards, it's kind of recommended no sexual intercourse, douching, basically nothing in the vagina for at least 1 to 2 weeks, depending on your doctor's preference.
Okay. How long does it take to get those results back?
Excellent question. Depending on your lab, I would say up to about 2 weeks, you can expect the results to come back.
Okay. Great.
Hope
That answers a lot of questions.
Burning questions. But again, if your pap smear does come back abnormal, take a deep breath. Most of the time things are okay. And we do these tests because we want to catch things early. So there's also ways, if there are abnormal cells, to treat them and to get rid of them. So that will reduce overall risks of, cervical cancer down the road.
Perfect. Well, thank you so much.
Thank you so much.
I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thank you for joining us at
HealthTalks.
Bye.